Most people assume an endoscopy appointment starts the moment the patient walks in. It actually starts the night before with a checklist most people never see. Today, I'm walking through what happens inside the endoscopy suite, from the prep instructions the evening before to the moment a patient wakes up in recovery. International patients usually worry about one thing here: the sedation. What they don't think about is everything happening around it. When someone comes in for an endoscopy, I'm already tracking 3 separate stages: prep, the procedure itself, and recovery. Each one has its own room, its own staff, and its own pace. Confusing the order of these stages is usually where the anxiety comes from. The morning starts in a smaller waiting area, separate from the main hospital flow. A nurse reviews the fasting and prep checklist before anything else happens, and I translate every question in both directions. This is usually the calmest part of the day, even though patients expect it to be the most stressful. Once the patient changes and the IV line goes in, I stay close enough to answer last questions, then step back once the anesthesiologist takes over. The sedation itself is quick. That part surprises people. Before the sedation starts, I always check which recovery bay has been assigned and confirm it matches the number on the wristband. One time, the bay assignments had been shuffled that morning without warning, and a patient briefly woke up to an unfamiliar corner of the room. Since then, I recheck every time. It takes 30 seconds, and it means I'm exactly where I need to be when they open their eyes. One detail I always watch for is how quickly the recovery area fills up around midday. If a procedure runs past 11, I try to request an earlier checkout time, because the room gets crowded fast after lunch, and finding a quiet corner becomes much harder. I used to think recovery was the easy part, since the hardest moment was already behind us. A patient once woke up disoriented and asked me the same question 3 times before it registered that I'd already answered. Now I wait quietly until I see real recognition in their eyes before I say anything at all. The procedure itself rarely worries people once it's over. It's the 20 minutes of waking up that decides how they remember the whole day.